Headlines this week on the rise of white lung syndrome in the U.S., worrying many parents heading into the holiday season. Hospitals in Ohio and Massachusetts are tracking a surge in pediatric pneumonia cases. So far in Ohio's Warren County alone, health officials are tracking 142 cases. And similar outbreaks are being tracked in China, leading 5 Republican lawmakers to call for a travel ban. We had former CDC Director Dr. Tom Frieden on the show this weekend and asked him if a travel ban on China is the right move.
Let's be really clear. Restricting travel may buy you a few days, maybe a week, to be better prepared. Nothing we've seen suggests there's a new pathogen that's emerged. And what are we doing now to get better prepared?
We want to welcome in now Massachusetts-based pediatrician Dr. John Kelly. Doctor, thanks so much for your time. Thanks for being here.
Thank you for having me.
Do you agree with Dr. Frieden's analysis? Would a travel ban on China help stop the spread of pediatric pneumonia here in the U.S.?
No, because what we're seeing in Western Massachusetts is the normal fall respiratory viruses that we see every fall, of which the primary one is respiratory syncytial virus, or RSV.
So you are on the ground in one of the areas that's seeing an outbreak right now here in the U.S. What can you tell us about what you're seeing right now? Should parents be more concerned this season than last year?
No, I don't think so, because what we're seeing is a normal uptick in respiratory viruses. Right now it's RSV. We'll probably start seeing influenza in a few months, and then COVID. We're not seeing a lot of COVID right now, but it's out there. But RSV is what we're dealing with right now.
I appreciate that. What exactly is white lung syndrome? You say it is not a diagnosis in and of itself, rather it's an X-ray finding.
That's correct. So white lung syndrome is not a medical term at all. When we look at a chest X-ray and we see pneumonia, there's a widening out of part of the lungs that should be clear, and it looks whitish on the X-ray, and that's where I think that came from. But it's not a medical term that I've ever heard of before this week.
I appreciate that. We also spoke with former CDC Director Dr. Tom Frieden about the lack of trust in public health, especially in the wake of the pandemic. Let's take a quick listen together. We know one poll found nearly a quarter of Americans have little to no confidence in CDC recommendations. How concerning is this? How concerned are you that when it comes to the CDC making this recent statement, or others going forward, that the CDC just doesn't have public confidence in the way it used to?
I am concerned, and some of this comes from information that people see that may be confusing or inaccurate on the internet and elsewhere. That's why it's really important that we in public health are very clear. We tell you what we know, when we know it, how we know it, what we're doing to try to find out more. Whatever we know, you should know.
So, doctor, have you seen this in your own community as well, that public trust in the medical system has taken a hit? And what does this mean for our future outbreaks?
Yeah, so I think I've certainly seen that, and during the pandemic, there was a lot of distrust on what's going on, and a lot of people coming to me and saying what they're seeing on the news or the internet, and I just hope that they will listen to the people that they're coming to see, their primary care physicians. In my case, I'm a pediatrician, and I hope my families take what I tell them is the truth, and based upon the best medical knowledge available. And not to listen to what they're seeing when they Google something.
It sounds like what you're saying tonight and what the CDC is saying is that this is not a novel or new pathogen. What's happening here in the U.S. is not connected to these terrifying images we're seeing in China of just packed emergency rooms there. I do want to ask what many Americans are doing. They're stopping using pandemic-era precautions. Very few people using masks in public now or social distancing. What do you suggest parents and people who are concerned about white lung syndrome do this winter?
Well, so I think if you want to prevent respiratory viruses, then wearing a mask is very helpful. During the 2021 winter, we saw no RSV, no flu at all. I mean, there was no one in the hospital with it. And it's because we were all wearing masks and we're all doing social isolation. Not that we can do that all the time. It's not tenable to do that. But certainly wearing a mask, and I'm starting to wear a mask in my office to protect myself from viruses that I'm exposed to. And we ask anyone in our office who has a respiratory illness to wear a mask as well.
Okay, Dr. John Kelly, appreciate your time. Thank you.
Thank you very much.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.